Hi, I'm Ron Zimmet of the Daytona Beach nursing home abuse law firm Zimmet and Quarles. Way too many of our clients come in with complaints about nursing home abuse. So what I want to do today is tell you some questions to ask and the times to ask them to help you prevent nursing home abuse. Nursing homes are required by law to do a thorough assessment of all their residents. The assessment is called a minimum data set. Nurses refer to this as the MDS. Once the assessment has been completed, the nursing home is required to have a meeting to plan the type of care to be provided the resident. This is called the care plan meeting. The resident and family members must be invited to the meeting. People from the various healthcare disciplines who will be providing care must attend the meeting. The initial goal of the meeting is to create a care plan that acts as a guide for the nursing home staff as to what type of care to provide and when. The care plan meeting is an opportunity for family members to influence what the nursing home does for the resident. Since this meeting is required by law and the nursing home staff are required to invite the family, it is, of course, important that family members attend. If you cannot attend at a specific time, don't be shy about asking for the care plan meeting to be rescheduled for another time when you can attend. This is also one of the best opportunities to prevent nursing home abuse. This is when you ask the questions. Here are some topics to ask questions about and specific questions that will make the point, among other things, that you're going to hold the nursing home staff accountable for providing good care. So here are some questions. First, are there any circumstances in which you would consider the use of restraints? Ask that to the nurses. If the nursing home has a restraint-free policy, ask the nurses, why do you think this is the safest for my family member? Second, more questions. What are you going to do to make sure that my family member doesn't fall? Have you assessed my family member for the risk of falling, and what is the result of that assessment? Third, how are you going to make sure that my family member's pain is well controlled? Fourth, is my family member at risk for developing bed sores? If my family member cannot move around in bed, what are you going to do to make sure that the nurses turn and reposition him or her every 2 hours? Have you considered the use of a special pressure relief bed to help bed sores? And why do you think that the bed that's being used now is the best for my family member? These are just a few of the topics you should be considering if you have a family member at a nursing home. For a lot more information, you can go to our website, zqlawyers.com. For now, I'm Ron Zimmet. Thanks for listening.